My name is Dr. Michelle Coletti, and I'm an occupational therapist with over 30 years of experience helping children to be calmer and happier through movement. I've worked with countless children who have difficulty paying attention in class, they can't sit still, they have many meltdowns or tantrums during the day, and during their tantrums, they can bite, they can kick, they can hit, they can headbang during their tantrums. Sometimes they'll demonstrate aggression towards other children in school or at daycare, have difficulty with authority figures, get in trouble in class, and can have difficulties with elimination. So, what I want to talk about is the neurophysiological basis on how movement and play can lead to calmer, happier children. First of all, I want to talk about some core principles, namely that children must enjoy what they're doing. If a child doesn't enjoy what they're doing, then they're not going to get the full regulatory effect, the benefit of that movement. That movement won't help calm their body over time if they really don't enjoy what they're doing. This movement, it must engage their mind, their emotions, and their body to have the greatest regulatory effect. Just a little example from my life. I don't exercise because exercise doesn't engage my mind or my emotions. And quite frankly, it bores me. I'll take a yoga class because yoga does engage my mind and it does engage my emotions. I'll do Qigong, I'll waltz, I'll foxtrot, I'll do the Lindy because all of those things engage my mind, my emotions, and my body. When our minds, emotions, and body are fully engaged in an activity, we experience the fullness of ourselves. And this is a very, very satiating experience. It's satiating because it taps into our full human potential. It taps into the fullness also of our brain and body relationship. So I know we usually think of development in terms of physical milestones. When does your child sit up by himself? When is your child crawling? When did your child take your first few steps? However, there are also emotional milestones. And this is because our emotional system learns about the world much earlier before the motor or the cognitive system matures. So a baby can coordinate the muscles in their face to smile, and they can hold their mommy's attention with that smile long before they can coordinate their arms and legs to reach for a toy. Long before infants can pull on a toy, they can pull on mommy's and daddy's heartstrings with their smiles. When mommy and daddy smile back, babies learn that they can have an effect on the world. This baby learns it can have an effect on the world first through its emotions. And then, as the motor system matures, the baby takes all of the experiences of having an effect on the world through their emotions and uses that to know that they can have an effect on the world through their motor system. And then crawls and starts to reach for things. Emotions help us know what feels good and what feels bad. When we feel good about something or an experience or a person, we move towards it because we want more of it. When something feels bad or it doesn't feel good or it's boring or we move away from it. It's not giving us anything. So why bother doing it? It doesn't feel right. This is really, really important. Knowing what we like versus knowing what we don't like allows us to make choices. It gives us the capacity to make decisions. Our brain must have a way of establishing what is useful, what is neutral, or what is harmful. Without it, nobody would be able to organize his behavior in any kind of functional way or really accomplish any tasks, or certainly not skillful tasks. Because to develop skill, that means that you have to focus on something for a long enough time to develop that skill. Well, you have to have your emotional system on board. You have to want to focus for that long, to practice those things that long. So our emotions are really, really key to anything that we want to accomplish in our lives. The value system in our brains works by increasing what is called the state of arousal. If it feels good, there'll be more emotional juices flowing to keep the child or us paying attention. If it doesn't feel good, eh, the emotional juices they'll dry up, they'll stop flowing. The child or us, yeah, we'll lose interest and we'll just walk away. If it feels really, really bad, the fight flight response can get activated and the child can get dysregulated, tantrum, and lose control. Emotion directly influences the functions of the entire brain and body, from physiological regulation, the state of our bodies, to abstract reasoning. Thoughts and emotions, thinking and feeling, cognition and emotion are biologically inseparable. You cannot have one without the other. They work together to create a functional mind. The circuits of the emotional centers of the brain connect to nearly every area of the brain. Emotions direct the mind where to focus. Emotions really are the fuel to all achievement. Our brain, our frontal lobes especially, in our cortex, it doesn't fully mature until the age 25. So you think about a 10-year-old child, a 5-year-old child, a 13-year-old child, that's pretty far away from age 25. So while children are still young, it's much more difficult for them to use a cognitive strategy to help them regulate their bodies and emotions. Meaning it's harder for them to like think, oh, calm down, because that's a top-down thing that comes from the thought first. It's much easier for young children and grammar school kids to help their regulation from what's called bottom up. And bottom up means movement and play and increased sensory input. So I want to talk a little bit about something called interoception. And interoception simply is all the sensory information from the insides of our body. It's from our internal organs, it's our heart, it's our blood pressure, the information from our kidneys, from our liver, from our lungs, our bowels, our bladder. All of that sensory information goes up to the brain because the brain's got to know what's going on in our body, right? So another internal sense is called proprioception, and that's basically muscle action. So whatever we're doing with our muscles, that information also goes up to our brain. There's another internal sense called vestibular. And what that means is our vestibular sense gives us information about our movement through space. So if we're walking, right, we're walking, then our body is moving through space, or our body could be still and our head could be moving. And either way, our vestibular receptors in our inner ear are stimulated and sends information up to our brain saying, hey, we're moving around, or the body's still, but the head is moving. Interoception is the ability to feel one's own body states and emotions. So here is a picture of the insular cortex. And the insular cortex is the part of the brain where all of that internal sense goes. It's the part of the brain that basically oversees our physiology. And what's interesting about the insular cortex is, as you can see, it's actually underneath these more familiar cortical areas. So this cortical area up here, this is part of the parietal lobe, and that's about sensation, integrating senses. And this is our temporal lobe, which has a lot to do with auditory processing. So here's the insular cortex. So the sense information from our bodies, the interoceptive sense information, first goes to the back of the, let's see, I think the back of the, okay, this is the front of the brain, this is the back of the brain. So the back of the insular cortex would be in here somewhere. So it goes here first to the posterior part, and then it moves here and it gets processed, and then it moves here. And when it moves here to the anterior part, it gets mixed with other information from our brains. And this is where we're able to perceive our emotions. So what's really interesting is that the raw materials of our emotional states actually comes from the sense information from our bodies, from our own bodies. So, a gross level of interoceptive awareness is basically, am I hungry? Am I thirsty? Do I have to move my bowels? Do I have to relieve my bladder? Now, a more refined or subtle level of interoceptive awareness is our emotional states. Am I angry? Am I sad? Am I happy? You've seen those commercials, right? Those Snickers commercials. Oh, you get upset when you're hangry. So what is hangry? Hangry means I don't know if I'm hungry or anger, if I'm angry. So what that is saying is that that hangry state, is a state where it's difficult for the person to identify what they're feeling interoceptively. Am I hungry? Am I angry? Am I tired? So again, the insular cortex is the part of our brain that oversees our physiology and allows us to have conscious perception of our body states and emotions. All of the sensory input from our internal senses goes to the insular cortex. This information gets mixed with information from other parts of our brain, which then becomes um, our ability to perceive our own emotions. So remember that the sense information from our muscles, the sense information from our skin, and the sense information from our inner ear regarding our position in space also goes up to the insular cortex. So what this means is that what we do with our muscles, what we feel with our skin, where our body is or our head is in space, all of this has the potential to contribute to our emotional health, to the state of our regulation. So, what I've discovered over the years is that children who have difficulty paying attention in class have many meltdowns or tantrums during the day. They might bite, pinch, kick, hit, or bang their heads during the tantrums, or bite, pinch, kick, hit other kids in class or at daycare. They can have difficulty with authority figures, they can get in trouble in class, and some kids have difficulty with elimination. All of these children, what I've noticed over the years, benefit from increased doses of their muscles moving, their skin touching, and their bodies moving in space through play. So, where this happens, where I work with children who present like this is what's called a sensory gym. And a sensory gym is this great room where there's mats on the floor. In our sensory gym, there's a large trampoline, there's a small trampoline, we have a ball pit, and we have a swing. So, what does it look like when I work with children who need help with regulation? Well, again, I go back to my core principles that children must enjoy what they're doing. Whatever they're doing must engage their mind, their emotions, and their body if it's going to help be the most helpful for their regulation. What I want for a child who comes into my gym is to experience the fullness of themselves. So if they want to jump in the big trampoline, great. I work with a child who loved to jump in the big trampoline, and there's a net that surrounds the big trampoline. And what he wanted was for me to toss him a ball. It was like a beach ball size ball, and he had a wiffle ball bat. So I toss him the ball and he'd hit it. I toss it, he'd hit it. I toss it, he'd hit it. And he'd be jumping as he'd be hitting it. Sometimes he'd say, toss it high. Sometimes he'd say, toss it low. So in playing with the child this way, he's giving himself ton of proprioceptive input because he's using his muscles to jump. He's giving himself a ton of vestibular input because his body, his head attached, right, is moving up and down in space. And he's experiencing the fullness of himself because this is an idea he had to do, and he's enjoying it to the fullest doing it. And he's in cooperation with an adult now. So what I want to do is just talk a little bit about some children that I've worked with. So I work with a 5-year-old little girl, and this is how her mom describes her when she first came to me. My child had significant emotional outbursts, drastic food aversions, always moving, unable to sit still, very rough play, including wrestling, tackling, body slamming, poor coordination, lots of bathroom accidents. Her sleep routine was very challenging, awake until 11 p.m. sometimes, unable to come down. So I saw her for about 6 months, once a week, and it's a 50-minute session. So after 6 months, this is what mom says. My daughter's outbursts have calmed significantly, and she can stop herself before hitting if she is mad. She will try new foods, which she absolutely would not have done before. Her play is still physical, but not rough. Lots of running and tumbling, but no wrestling, tackling. She has many fewer, almost no bathroom accidents, and seems able to tell when she needs to go. She's now on a regular sleep schedule and wakes up with energy. And this little girl, when she first came to me, the only thing she wanted to do for the first 2 or 3 months was swing on the swing, right? So we have what's called a platform swing, where it's a square piece of wood with a carpet on it, and then it's got four ropes going up to a central um, D ring to hold it to the. So what she would like to do is just swing, swing wildly, and she didn't just stand on the swing. She would lift one leg up and then the other leg up. So what I would have to do is kind of hold on to either the ropes or the bottom of the swing just to kind of make sure that she was safe. So for months and months, this is what she did. Swing, 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 swing. She's like, there's a storm brewing. And I'm like, aye, Captain. So this was not just the imaginary play, but the story behind the physical movement that she was making. And as I said, we did this for the first couple or 3 months. And then she started to, do other things and make up other little games. And she wouldn't have to be on the swing the whole time. And the result, of course, is what mom is saying is that her regulation improved dramatically. Um, so, as I was saying, this bottom up way of working with regulation with young children is very, very, very effective. So I work with a 8-year-old boy. He was very impulsive. He was angry. He was not aware of how big his feelings were. He got easily frustrated. And I worked with him for about 5 months, 50-minute sessions once a week in the sensory gym. And now mom says, my son seems able to down-regulate himself better. He recognizes his triggers more and can talk about them. He sometimes says, oh, okay, I'm getting hyperactive. I'd better slow down. I've even heard him say, calm down to himself. Another boy, he was 5 years old when I started with him. He was physically disruptive at home, school, and with other children. He actually needed a behavioral interventionist in his kindergarten. He had difficulty reading nonverbal cues. He was kind of handsy with other children, and he had a great difficulty following auditory directions. So I worked with him for about 11 months, once a week, 50-minute sessions in the gym. And dad says, while he is still having some regulation challenges at school and in general, it's significantly improved from where he was at the beginning of the year, or even versus 6 months ago. We're not getting any repeated reports from school of hitting, poking, etc. So if your child is having difficulty with regulation, is having tantrums and meltdowns and exhibiting aggressive behaviors, either during the tantrums or in school, or is having trouble paying attention in school, and you live in the Pasadena, California area, and you would like to work with me, you can email hello@greenhousetherapycenter.com, and please let them know that you found me through this YouTube video, Calmer, Happier Children Through Movement. I'm Dr. Michelle Coletti, occupational therapist. Thank you very much.